Welcome to King Abdullah bin Abdulaziz University Hospital Nursing Affairs Department. On this video, we are going to discuss the physical restraint policy and application procedure. Restraint is a means to limit or restrict movement of the person or a portion of the patient's body as a way of controlling his or her physical activities. Physical restraints is any manual method or physical or mechanical device, material, or equipment attached or positions adjacent to the patient's body that he or she cannot easily remove, that restricts freedom of movement or normal access to one's body. Only staff nurses who have been trained and deemed competent in the use, application, and removal of restraints are permitted to apply, release, and remove restraints. Staff nurses must be committed in limiting the use restraints to clinically justified situations, and only after less restrictive methods have been evaluated and determined to be unsuccessful or inappropriate. Such situations may include prevention of imminent harm to the patient or others when the other means of control are not effective or inappropriate, prevention of significant damage to the physical environment, prevention of patient tampering with treatment modalities, patient activity or expressed thoughts which indicate reasonable probability of harm to self or others. The use of restraints must be initiated by individual physician orders written specifically for the patient concerned, time limited such that 24-hour maximum duration per order for an adult patient and 4 hours maximum duration per order for a pediatric patient. Documented in the patient's medical record in TRACARE or downtime form. The least restrictive type appropriate to the episode shall be used, and use only of the type approved by KAAUH. Instructions for use. Wrap the limb holder around the patient's wrist or ankle, ensuring that the cuff closure is on the outside of the device. Secure the hook and loop and/or buckle closure depending on the style of the limb holder. Find the location on the frame of the bed to ensure the straps, making sure that the location moves with the patient. Secure the strap quick release ties or quick release buckles depending on the style of the limb holder. Assessment and monitoring. At a minimum, patient must be checked every 30 minutes while restraints are in use, and documentation of findings are recorded every hour on the physical restraint monitoring form as shown. Documentation on the physical restraint monitoring form includes restraint location and type, whether the restraint is being applied continuously or intermittently, nursing arm provided, patient repositioning provided, vital signs completion, position circulation, pulse, skin integrity, and range of movement of the restrained area, patient behavior, the continued need or not for restraints, emergency initiation of physical restraints. The physician will be informed of the reason for the emergency initiation of a restraint, medical management, violent, self-destructive, or behavior management. After initiating emergency restraint, a physician must be called immediately to perform an assessment of the patient and write the order for restraint in physician order sheet or electronic medical record. After emergency initiation of a restraint, the healthcare practitioners caring for the patient will document in the physical restraint monitoring form the date, time, and name of the physician notified, and the type of restraint used and any conditions for maintaining the restraints. Reminders. Patients shall never be placed in a restraint as a means of discipline, for staff convenience, or as a way to control behavior without clinical justification. No PRN orders for restraints are allowed. Each restraint episode requires a physician's order that indicates the reason for restraint, type of restraint to be used, and the duration for which the restraint may be applied. In emergency situation, A telephone order for restraint is accepted, but the physician must assess the patient and write an order within 1 hour of the telephone order. Here in KAUH, we establish a patient-focused process for the implementation, application, documentation, and monitoring of the use of restraints. We promote collaboration between the multidisciplinary team and families to ensure the maximum safety and security in relation to the use of physical restraints.